Welcome to today's session on surgical patient, an aid to clerking for medical students. What is clerking a patient? Clerking a patient is the first and the most important contact that any medical student has with his patient. The main purpose of this clerking is to obtain a detailed history of his symptoms and perform a physical examination on him to elicit the signs that he may have. With the symptoms and signs collected, you should then come to a reasonable and logical provisional diagnosis and a couple of differential diagnoses. Before we move on, what are the right attitude of a student be to his patient? First, you must have the right attitude of yourself too. There's some fear and anxiety on encountering a patient for the first time. But if you get started with the right attitude and in some special efforts to know your patient first, the rest will fall in place in due time. Secondly, right attitude towards the patient is essential. And the 3 C's attitude of courteous, concern, and compassionate will go a long way to facilitate your relationship with your patient. At times, the patient's abnormal patient reaction is at times exhibited by the patient. They become uncooperative, indifferent, and even angry with you. This is due to the fear and anxiety, due to the uncertainty, the disease, and the possibility of death. The patients are humans with emotions and feelings like every one of us. There are some unwritten rules which you must adhere when dealing with your patients. First, the patient is always right as far as his illness is concerned. Second, the patient knows his illness best. Treat his information with utmost confidentiality. Always respect his decision on treatment options. And lastly, treat always, cure sometimes, but never cause harm at any time. It's important to remember the learning process in medicine is a lifelong one, and it gets better with time and experience. The more patients you see, the better your skills in diagnosis and treatment. Okay. Now we come to some common symptoms in surgery. First, in the history, the most important symptom in surgery patients is pain. Okay, it's the most common. Over 90% of patients present with pain in some form or another at some site and with different severity. It is very important to document the onset of the pain, the duration, progress, radiation, severity, and aggravating and relieving factors of this pain. The second most important symptom is complaining of a lump, mass, or swelling in some part of the body. Again, it is important to address this onset, the duration, whether it is localized or diffuse, associated swelling or edema, the skin changes, and also the color of the skin overlying the lump. The third common symptom in surgery is bleeding, and this can be hematemesis, the vomiting of blood, melena, passing of black stools, stale blood, or black stools in stools, hematuria, passing of blood in the urine. In any of these conditions, all these conditions, it is important to document the amount of blood the color of the blood, the presence of clots, and whether it's associated with pain or otherwise. Other less common presentations include ulcer, sinus, and fistula. Okay, again, it's important for if these symptoms, you have to ask this for the site of the ulcer or fistula, the size, shape, ages, the base and the edges, especially in ulcers, and the surrounding changes in the skin. Next is discharge, and once there is some discharge, it is important to document whether it is serous, pus, mucus, or blood. Blood-stained discharges are always very significant because it could be the precursor or to a malignant lesion underneath. Fever is another common symptom, and in fever, you must always uh, describe the nature of the fever and its association with either the chills and rigors, okay, and sweating. So these are important aspects of the fever that you must document. And lastly, nausea and vomiting, especially for abdominal cases, you must always look for the contents. What are the contents of the vomiters? The color of the vomiters, whether it is projectile, and its frequency and severity. In all these symptoms, it's important to always find out the duration of the symptom, the nature of onset of the symptom, whether it's acute or chronic, and whether it's progressive or regressive. In pain assessment, the mnemonics used is Socrates, okay, which refers to site of pain, onset, acute or chronic, character of the pain, radiation of the pain, other associated symptoms with the pain, the timing of the pain, okay, the time frame of the pain, and exacerbating and relieving factors and severity of the pain. Okay. Now, what are the common signs in surgery? First, lump, mass or swelling. Secondly, tenderness, when there is a pain when you press on the lump or mass. Jaundice is another important sign of in surgery, for especially surgical obstructive jaundice. Pallor, and there's a in cases of bleeding, GI bleeding especially, hematemesis or hematochezia. Guarding or rigidity of the muscle overlying the mass or lump, especially in the abdomen. Loss of function due to pain or deformity. Whether there's swelling, edema, or ascites. And lastly, wasting, emaciation, and cachexia. These may be signs of malignancy or signs of malnutrition and uh, chronic illness. Next, we come to the format for the clerking of a surgical case. Okay, first you have history, the case history. In the history, the identifying data is very important. In particular importance is the age of the patient. Okay, it's very important to document the age of the patient. Others important features will include the chief complaint or complaints in chronological order if there are more than one complaints. The chief complaint is the complaint that brings the patient to the hospital or the doctor. Subsequently, you go into the history of present illness in chronological order. Arrange the symptoms in the patients in order chronologically or in chronological order. Then you have to look into the relevant associated positive and negative symptoms. The review of the system, get a few symptoms from each system to see whether it is normal or abnormal. ONG history, especially in women at risk. Past history is very important, and in surgery, medical and surgical histories are important, and in surgical history, you must try to get details of surgery done, if any. Okay, when was it done? What was the surgery? And were there any complications? Drug history, allergies, drugs and dosages, if possible, must be tried as hard as possible to get from the patient or the relatives. The family history is important, especially in some cases, tumors, like colonic tumors, which tend to run in families. And of course, go into the complete nutritional and diet history, the social and occupational history as well. Having got this case history, then we go into the physical examination. Physical examination, which involves general inspection, looking for pallor, nutritional status, any jaundice, anemia, and then you look for the vital signs, blood pressure and pulse rate. Okay, then you look for relevant signs in relation to the chief complaint. Okay, the chief complaint is vomiting of blood, then look for signs of anemia. Local or specific examinations in relationship to the chief complaint. Okay, look for example, if it's an abdominal pain, then you look for examine the abdomen for specific signs in the abdomen. And then review of the system, review examination of all the systems from head to toe. Okay, after the history and examination, we continue with uh, the formatting. We look for the clinical summary. Okay, you provide a short clinical summary, which includes the important features in the history and physical examination. It should be short and precise in about 5 to 6 sentences. From this is clinical summary. You go on to provide a provisional diagnosis, which is the most likely diagnosis based on symptoms and signs in this patient. At the same time, you should be also able to give at least 3 other possible differential diagnoses for the patient. After this diagnosis is entertained, then you go on to investigate, to the investigations to confirm or exclude your diagnosis. Okay, it is always important to start with the least invasive, uh, less affordable, and least or no complications, little or no radiation, and easily availability. These are important things must consider when you order your investigations. And these can be blood investigations, urine analysis, imaging such as X-rays and ultrasound, or it can be endoscopic and or other forms of biopsies, tissue biopsies to confirm the diagnosis. So after the investigation, you should derive at the final diagnosis from the investigations. And once the final diagnosis is finalized, we may go next into definitive management and treatment of the patient. Always have an outline plan for the patient's treatment. Okay, thank you for your patience and hope to see you again in another session.